In our anatomy app, you can record narrated videos describing various components of anatomy that are relevant to the subject matter you're teaching. You can pull structures off the body. You can draw all over it as needed. You can use a laser pointer to highlight structures that are relevant to you. And lastly, there's a pair of forceps you can use to point at things, talk about surface level structures, and show trajectories upon the body. These tools combined can give you a great sandbox that you can use to educate your students. You could, for instance, pull off pieces of the shoulder in order to show the approach you would want to use to get into the shoulder joint. You could use the marking pen to draw out the incision that you would want to make upon the skin, and then furthermore, discuss all of the structures therein that you would encounter on the way in during a surgical approach. These features alone aren't sufficient to teach to the highest level possible. We've built in this blue button here we call our patient menu, and what this allows you to do is augment the experience furthermore. We can toggle and hide different layers of anatomy. I could turn the muscles off, and now we just see my bony structure with my original incision line. I can turn on the circulatory system, and I can choose to also turn on the nerves at the same time using the submenu. And now you can discuss with your students the various different approaches you would want to use to avoid the nervous system and the circulatory system upon a surgical approach. In addition to these layer toggles, this submenu gives you additional options as well. You can turn the labels of the anatomy on and off to bell ring your students if you really want to test them on what they think a structure is called. Then turn the labels back on to check their work. You can also have this toggle turned on and off to show anatomical guides for a very novice student that's still learning all of the terminology around anatomy. The most important feature, however, is what we call our Zoom To feature, which allows you, by using this magnifying glass, to select a part of the body that you wish to zoom into. In this case, let's continue on the shoulder. I'll press the plus button near the shoulder. I will select a left shoulder and then proceed. After a brief period of loading, I'm put back into the same case, but this time the shoulder is zoomed into, and it's now about 3 times life size, which gives us a great opportunity to pull apart the shoulder and see all of the anatomy in its great detail, as well as being massive. You can now talk about the lesser tuberosity and the greater tuberosity in vivid detail. You can still use that marking pen from before in order to draw out fracture lines on the bone, for instance, and then discuss with the students about plating options, how you would plate, how you would nail, how you would repair a case of trauma. This is especially useful to stem discussion around what strategies a surgeon might use and what tools they might need in order to repair it correctly. As you can see with this very brief tutorial, there's a ton of capability here to help you teach and augment subject matter to the exact specifications that you need. The anatomy is fully interactive, tailored to show exactly what you want, and repositionable in 3D space.